My name is Natalie Parks, and I'm an assistant professor at Dalhousie University. The topic of this talk is comorbidity and persistence of disease-modifying therapy use for relapsing remitting multiple sclerosis. Comorbidity is common among individuals with multiple sclerosis. Comorbidity delays MS diagnosis and may increase the risk of relapses and disability progression. Comorbidity may decrease likelihood of starting a disease-modifying therapy and increase risk of discontinuing initial DMT due to lack of tolerability. The purpose of this study was to evaluate the effect of comorbidity on initial DMT persistence along with reasons for discontinuation. We identified individuals using a clinic database with relapsing remitting multiple sclerosis or clinically isolated syndrome starting an initial platform disease-modifying therapy including glatiramer acetate, interferon beta, dimethyl fumarate, and teriflunomide between 2001 and 2016. Comorbidity was determined using administrative case definitions defined by ICD-9 and ICD-10 codes applied to an administrative database. Overall, we identified 1,464 individuals who met study inclusion criteria. The most common disease-modifying therapy in this population was interferon beta, followed by glatiramer acetate, dimethyl fumarate, and teriflunomide. In this population, there were 62% with zero comorbidity, 29% with one comorbidity, and 9% with two or more comorbidities. The most common comorbidity was a mental health disorder, followed by hypertension. The median persistence of initial disease-modifying therapy was 4 years and did not differ by comorbidity count. Cox proportional hazard regression analysis did not reveal a difference in risk of discontinuing initial disease-modifying therapy by comorbidity count. In terms of specific comorbidities, there was increased risk of discontinuing initial DMT in the presence of a mental health comorbidity with a hazard ratio of 1.2. Individuals with a mental health comorbidity discontinued initial disease-modifying therapy at a median of 3 years versus 4 years for those without a mental health comorbidity. In terms of reasons for discontinuation, there was increased risk of discontinuing for lack of tolerability in the presence of 2 or more comorbidities, according to logistic regression analysis. There was no effect of comorbidity count on discontinuing for lack of efficacy. Overall, we found individuals with a mental health comorbidity are at greater risk of stopping disease-modifying therapy. As well, we found individuals with high comorbidity count are at greater risk of stopping DMT for lack of tolerability. Thank you.